something. So I want to take a closer look at performance-enhancing drugs. Call it a primer with CBC's medical specialist, Dr. Karl Kabasele, who joins me here in studio. As we get our heads set into Olympic mode, let's look into what are they and how do they work briefly.
Sure. There's a sort of a wide variety of agents that can be used. For example, well, maybe the most common one people think of are steroids. Steroids help to build muscle, make them stronger, make them fire faster, but interestingly, they also help the muscles to recover faster. Tired muscles sort of get back to readiness faster when people are on steroids. The other categories are things like so-called blood doping. So you can either take a drug like EPO, which boosts the production of red blood cells. So that
which carries more oxygen around your body?
Exactly.
Okay, biology 101.
There you go. So the idea is, you want to increase red blood cells. You could either boost it with meds, or you can put more red blood cells into the system by a transfusion. So that's another way it's done. You can use anti-inflammatory steroids, which help to heal wounds faster, or injuries, which these elite athletes sometimes will get. So there are a lot of different ways that medicine and pharmacology can help to improve the performance of these athletes.
You got to wonder, though, why do these athletes use them? We know the health risks associated with doping. We also know the career, what is it, a CLM, career-limiting move, right?
Sure, yeah. Well, you can imagine the pressure, particularly when you think of the Olympics and these races with these finely tuned athletes, and where a millisecond can be the difference between, being on the podium or not. Sort of human nature, there's a lot at stake. You want to do well. You figure the others are doing it, so I'm going to do it too, regardless of what can be sometimes, life-threatening health consequences of taking these things.
Let's talk about some of the consequences, side effects.
Sure. Well, let's start with the blood doping. So, yes, you increase the red blood cells in your blood. It carries more oxygen. You can sort of perform better, but because there are extra cells in the blood gets more thick, it gets more viscous, and so as a result it can get blocked. And what happens when blood stops in an artery or a vein? You get heart attacks, you get strokes, you get blood clots, deep vein thrombosis, things that can literally take your life. So now we look at things like, the steroids. Steroids, yes, they build muscle, but on the other hand, they can lead to problems with the liver, with the kidneys. They've been associated with liver cancer in some rare cases. They can change your behavior, cause depression, mood swings, irritability, aggressiveness. So these are not medications without side effects that can actually very seriously affect your quality of life.
And how are they tested for?
Well,
is it just taking blood?
Basically blood samples, urine samples, anywhere where these drugs or the byproducts of taking the drugs manifest themselves in tissue, usually blood or hair or urine. But the key here is that the athletes and the labs that manufacture some of these meds are oftentimes a couple of steps ahead of the testers, of the screeners. So what you can do is you can time when you take those drugs so that they wash out of your system before the tests happen. You can use masking agents, which sort of remove the traces or the evidence that you've taken something. And these labs are very tricky. They're producing new performance-enhancing drugs that can't be detected because there's no test yet, because nobody knows they really exist. So, it can be difficult.
And I also want to talk about, who uses them. I mean, here we are talking about this because of Lance Armstrong and the allegations against him. We're leading into the Olympics in London. There will likely be more stories of doping or anti-doping protests, etc.
Sure.
But is it just elite athletes, or are young people taking them in the gym to bulk up? Well, I don't know. I've never taken them.
Yeah. Well, you're right. We know that kids tend to look up to their sports idols, and if they know that they're taking some of these things, maybe they're tempted as well. Maybe their peers are taking it, and there's that peer pressure element. What we worry about, of course, is that young developing bodies may be more susceptible to some of the effects that we've already talked about. And here's a paradox for you. Human growth hormone, which promotes growth of muscle and other tissue, when kids take it, it can actually stunt their growth, because what it does is it sort of accelerates the process of bones, as a teen goes through their growth spurt. The bones are growing quickly, but because that process is accelerated, they could stop growing before they should.
Wow.
And therefore, the person ends up short of stature. Obviously, when you're talking about steroids, testosterone, and growth hormone, these can have impacts on the sexual hormones. So, you know, girls become masculinized, more muscle, but hair in places they don't want it, obviously. And boys can start to grow breasts, depending on what they're taking as well. And we know that, of course, there's that rapid sexual development that happens during adolescence, and some of these drugs can throw that off as well.
Very serious implications. Always a pleasure, Karl. Thank you so much.
Thank
CBC
you.
medical specialist Dr. Karl Kabasele.